A good day to all my fellow prosthodontists. My topic is the virtual patient, establishing new frontiers in dentistry. At the outset, I'd like to state that there is no conflict of interest in my paper presentation. Coming to an overview of this topic, we will deal with an introduction on virtual patients. We will cover the aims and objectives of this presentation. We will understand the types of virtual patients in dental education, virtual patients in clinical practice, what is the future of virtual patients, and finally, we will conclude by summarizing all that we have gathered in this presentation. Coming to the introduction. Over the past few years, we have seen a shift from manual-based to virtual-related workflows. In prosthodontics and implant dentistry, we have seen a widespread implementation of computer-generated data. If we utilize this digital data, we can create a virtual portrayal of a patient. So, virtual patients are digital simulations of real human beings and related medical findings. So, the basic idea of a virtual patient is to create a database, that is electronic health records, create electronic case scenarios for student education as well as for research purposes, 3D computer-based reconstruction of human body parts. So what is the aim of this presentation? One, it is to summarize the current status and the latest progress in the field of virtual patient science. Also, to identify further research needed in this science. The objectives of this presentation are then this. One, to encourage us to use virtual patients as a training tool in dental education, to encourage research groups and medical companies on collaborating in developing better virtual patient simulation, and to encourage the development of virtual patients for implementation into routine clinical practice. Now, there are two types of virtual patients based on their purpose. You have virtual patients in educational simulation, that is for dental education, and for simulation of patient-related issues, that is virtual patients which are used for dental diagnostics, treatment planning, and execution. Virtual patients in dental education. Now we have 12 virtual reality simulators which are currently available. Some are already in use, some are still in development. The commonly used virtual reality simulators in dental education are DentSim, Forsland System, HapDent, HapTel, Iowa Dental Surgical Simulator, Moog, Simodent Dental Trainer, PerioSim, Verdant System, VertEC Simulator, Virtual Dental Patient, Virtual Reality Dental Training System, and Voxelmin. Now, virtual patients which are used for dental education are of two types. Simulators which are used with mannequins, dental simulators based on haptic virtual reality. We will now discuss three systems which use different technologies and have different applications. The first system is the DentSim system. Now, this system uses a common physical phantom head, a handpiece, but it also has an optical tracking camera. This transfers and visualizes the movements made in the phantom head onto a computer display. The computer then gives immediate on-screen feedback regarding the procedure which has been carried out. The next simulator is the Moog Simodent Dental Trainer. Now, this is a haptic type of dental trainer. So there is no need for a physical phantom head. The display projects the mouth and teeth of a virtual patient as a stereo image on a mirror. A haptic device generates a tactile feedback. Wearing stereoscopic glasses, spatial illusions can also be created. The simulator is also connected to a courseware computer. The third is the PerioSim, a virtual human mouth including teeth and surrounding gingival soft tissue is recreated here. The device is mainly used for training students in periodontal surgical procedures. It comprises of advanced haptic components, the high-performance PC and graphics card, and stereo glasses for 3D visualization. How efficient now are these dental simulators? According to Buchanan, mannequin-based dental stimulator increases academic performance compared to traditional preclinical methods. Instructional time spent by teachers is reduced when using DentSim simulators. This is as per Jasvikis. Becker et al. Reported the potential benefit of improving manual dexterity after short-term exposure to a Simodent dental trainer in undergraduate dental students. Next, we come to virtual patients in clinical practice. For a virtual patient to be used in clinical practice, it must be an exact representation of the real patient, but in a digital environment. It should provide more information than one can directly get from the patient to be of any significant use. And we are still far away from a realistic, practical, and widespread implementation of virtual patients in clinical practice. However, virtual patients have been used. The first CBCT system with an integrated 3D facial photo acquisition unit was established by Planmeca. Kao et al. Used a commercially available software to fuse different data sets of a human being, including facial surface scan and CBCT data to generate digital study models. Joda et al. Presented a workflow for superimposition of intraoral scan, cone beam computed tomography, and extraoral face scan for creating a 3D virtual dental patient. He found this type of a patient very useful in planning treatment as well as in communicating with patients. Lee Q et al. Described the application of a virtual dental patient with dynamic occlusion during aesthetic restoration in a digital workflow. To create this virtual patient, an intraoral scanner, a facial scanner, a jaw motion analyzer, and a CBCT scan were used to transfer patient data and construct this virtual dental patient. He found that the treatment was much more accurate and precise. The creation of a three-dimensional virtual dental patient for computer-guided surgery and CAD/CAM interim complete removal and fixed dental prosthesis has also been done. This uses two-dimensional digital photographs, a 3D extraoral facial scan, and cone beam computed tomography. So what can we expect in the future? Tanzawa et al. Described a robot patient for dental education, which is designed as a full body replica capable of secreting saliva and capable of communicating with the users. We can also expect an integration of augmented reality in which virtual data is superimposed on living objects. So the treating doctor gets an impression of seeing inside the patient. It will be also possible to integrate all the data we can collect from the patient in one virtual patient model. So finally, we can conclude this presentation that virtual patients really need to be incorporated in our dental education. We can also see that they can be very useful tools for preoperative clinical assessment, treatment planning, documentation, as well as communication. Thank you everyone for your patient hearing.